I look forward to being critiqued in your feedback and insights into something very special. Ready. So I've been practicing this 10-minute pitch with the group here at TechTown, so this will be my first formal presentation on something that's very important. I'm Joe Gleason, CEO and co-founder of Genus. Genus is a care platform that's poised to transform the way we go about caring for those we love. The concept of Genus comes from being there. I was a caregiver for my father, who suffered with dementia, and now with my mom. And I saw firsthand the impact of being a caregiver that it takes on your siblings, your children, your spouse, your family, and those around you. It's not easy. Having started 3 companies and taken a variety of products to market, I couldn't help but ask that question: how do we take the data from daily care and create something meaningful? Today's generation of caregivers is also called the sandwich generation. That guy in the center, if he had less hair, that very much could be me. The caregivers, we're busy taking care of our children, our careers, our parents, and it's stressful. It's not easy, but in the end of the day, when we started looking at how big this market is, it's substantial. Today, by the numbers, there's 43 million Americans acting as unpaid caregivers. It's not easy being a caregiver. The vast majority of those caregivers will tell you that their relationships suffer, their careers suffer, and 50% will admit to falling into depression, let alone their kids, and the financial impact. Being a caregiver, the studies show that it's north of $200,000 in loss of income just in your career and benefits that go on, let alone the out-of-pocket costs. The providers that we're going to talk about today in the equation, and there's several in this equation, the primary care physician, 50% of them will tell you that they're limiting the number of new elderly patients that they take into their practice. Why? Because they're increased cost of care for them and lower reimbursements. And the insurance industry, referred to as the payers, besides the concerns coming out of the White House with daily tweets, they're worried about the 70 million Americans by 2024. They're going to be facing 2 or more chronic conditions. So how do you solve a problem this big in scope? It turns out that communication is the answer. What we found is that in studies we've looked at, when you take caregivers and you connect them and you empower them, we see a 25% reduction in readmittance to the hospitals within 30 days. What's that equate to? For Medicare alone, that's a savings of $7 billion a year. So communication, what do we want to communicate? As caregivers, we want to communicate all things care. Who spoke to mom and dad last, and all the pieces that go with that. As a physician, we want to take that data from caregivers and find a way to bill for it. And the insurance industry, they want to find a way to incentivize physicians and caregivers to work together. Well, the AMA, together with the Medicare, put together a billing code called CPT 99490. That code incentivizes the physician to collect that data, put together a care plan, and put in place a proactive plan that helps families keep mom and dad living at home longer. They pay the doctor $42 a month, $500 a year, and Stanford will tell you it's worth $77,000 a year to the average primary care physician. So how do we go about addressing that? We created what we call an open platform for care, Genus. It's first and foremost, it centers on daily interaction. Who spoke to mom and dad last, taking each point of contact to collect data. That data is then produced into a detailed care report that's shipped up to the primary care physician's EHR, to which they can review, confirm, and bill upon. And the insurance company looks at that as a great way to support that program and identify the care team. A closer look at Genus, first and foremost, it centers on daily communication. The simple act of my son taking my mom for a walk in the park, he can hit a little slider, say how was she emotionally and physically. My brother in California can say I like that. He's rewarded and encouraged. And it's an open platform, which means it's modular based. People can add their own programs and utilities to it. Of course, there's a medical module and local resources. So what's it worth? Take those 43 million adults acting as primary caregivers and connect them with the physicians with the data they're collecting. The physicians are looking at an $18 billion a year additional revenue, with $2.5 billion available to the company facilitating that transaction. Competitive marketscape, there's a variety of companies out there. We can save that for the Q&A and how they go about it, but there's 2 different philosophies in place there. Our traction, I'm happy to report that not only do we have a product in the store, but Henry Ford has announced that Genus will be the recommended care app of choice. We've passed their security reviews, and they're just now beginning promoting it at the local trade shows that we attend. So there you have it. I'm running out of time with Genus, but we deliver a $6. We charge the primary care physician $6 a month. $11,000 a year is our average collection for the primary care physician, to which they get a 6-to-1 ROI. And I want to jump into just a real quick look at how you take something like this and you go to market. First and foremost, you reach out to the caregivers, get them using and engaging your program. You do it by social media, working with local care groups such as churches and organizations that provide care. Once we achieve density, we reach out to the primary care physician, not their physician, but the actual practice manager, and say we have an opportunity for you to not only deliver better care, but great billing and revenue opportunity. And then, of course, going forward, we have the opportunity to reach out to the payers who service that market. And by year 5, we're looking at $80 million a year in potential revenue with a $23 million EBITDA. And the team behind that, we've worked together in the past. We're experienced in this area, and we're extremely passionate about what we do. So there you have it, how a small company for Detroit is positioning itself to make a big change in the way we go about caring for those we love.